Welcome to Citrine Presents. My name is Susana and I'm one of the community resource navigators at Citrine Health. Our mission is to connect women and their families to services and resources for health and wellness. We are a nonprofit social service agency that has been supporting our community members for the last 26 years. We are located in Everett, Washington, and we help 6 surrounding counties. But if you are not in the area, we will give you ideas on how to reach programs in your community. Citrine Health currently has 4 programs. The first program is our breast and cervical cancer screening program. The second program is the Bra Shop, which specializes in post-vasectomy items. The third program is our Women's Wellness Center with yoga classes. Our fourth program is the Community Resource Navigator, connecting people to what they need. These are educational videos regarding health and social services, as well as the information on specific topics that may interest you. For more information, check out the links at the end of the video and stay tuned for future videos on these programs. Welcome, everybody. I want to introduce Ann Miles, who handles our provider relationships for the breast cervical health program for Citrine Health. How are you today, Ann?
I'm good, thank you.
Good. I am very excited to be able to talk to you today because some people may not know who Citrine Health is, and you are the perfect person to tell us about the history of Citrine Health. But first, I wanted people to know who you are and tell us what your role is and how long have you worked for Citrine Health?
I've been a part of this organization for 22 years. The first 3 years were as a volunteer. I started working part-time in the office in 2003 and then full-time in the office in 2006. I currently now work part-time from home as the contact and trainer for all our BCCHP providers.
Wow, and that is a very long time. And this is why we thought you would be the best person to say the history of Citrine Health. Can you tell us about that and how did Citrine Health start?
Citrine Health began when Carrie, our executive director, was working on her master's in social work. She was working at the Snohomish Health District at the time and given the responsibility to put together a luncheon for women living with HIV. At the time, there were very few services in Snohomish County for women with HIV. Some things were going on in King County, but Snohomish County didn't have much. So she put together a luncheon. She partnered with one of the first women in Washington State to be diagnosed with HIV. And they put together a luncheon at Christmas time that was so well received by the women and their providers who also were invited that out of that grew our organization. In 1996, we became a 501c3 or a nonprofit agency and became known as the Positive Women's Network. The first program in Positive Women's Network was we were having luncheons and educational presentations. Those luncheons that we talked about, they continued once a month. Educational presentations, annual events, informal gatherings, newsletters, all for women living with HIV. We did gradually grow since we were a nonprofit agency, we could add other different programs. So we started with a contract to do outreach for children's medical. At the time that the children could get enrolled into DSHS medical and people were not aware of it. So we did outreach for the children's medical program. And then we also added a contract with BCHP to do outreach for the program. BCHP, as we've learned, is the breast and cervical health program, and that is for women who don't have insurance to get free mammograms and PAPs. So we did outreach for all the programs throughout the 5 northern counties. Now, in 1999, when the case manager at the Snohomish Health District was leaving, she had started a program for massage for women living with HIV. And so she called Carrie to see if it was something that she could take on after this woman left. So Carrie made it one of the programs of the Positive Women's Network. And we opened it up, and right after we opened it up, and that's where I came in because I was a massage therapist, and I was the first massage therapist in that program. And we quickly opened it up, realizing that massage is beneficial, excuse me, not only for women living with HIV, but women living with all kinds of chronic conditions. And so it became a program that if you were a woman living in Snohomish County with a chronic illness or disease, you could get a free once-a-month massage through our program. We also added Reiki treatments to that program, that you could get a free Reiki treatment. And then we also had coping skills support groups, which was a room full of women with all different chronic conditions coming together to talk about how they were dealing with their pain. And it was very, very successful, really well welcomed by the women. But our roots are in women living with HIV and other chronic conditions.
And you mentioned that we added Reiki to the program. Can you explain to us what Reiki is?
Reiki is an energy work, and it's actually like an energy massage. You get it the same way as on a massage table. It's very little touch of the body. It's more working within the energy fields of the body. It can be very effective.
How has Citrine Health grown to meet the changing needs of the community?
It grew in many ways. BCHP grew when we became one of the prime contractors for that program in the state of Washington. The program is out of the Department of Health, and Department of Health manages, and there are 5 prime contractors. And Citrine Health became that prime contractor in 2006. What that meant is that we contract directly with the mammo centers and the clinics and the providers within the 5 northern counties. And then in 2012, we also added Pierce County to that. So that really grew the organization because we're contracted directly with those clients, and it grew that program so we could offer it to more people. In 2009, there was a separate grant added to the program for the colon program. We at that time became the breast, cervical, and colon health program, so we could get colon screenings for men and women. That grant has since not been ended. It's a federal only grant, and it has since ended. But the breast and cervical program is still going strong.
And the colon part of the grant ended about a year ago. Is that correct?
About right before the pandemic, about 2018, 2019.
And if somebody wanted to be able to find a place to help them with that, we do have resources. So please still call us. We'll be able to guide you to the best way. And what other programs has Citrine Health provided for a better help of the community?
Well, we also, as we're part of our growth, that children's medical outreach that we started grew, and as we started offering information about the basic food program as well, so that people could sign up for the basic food program. We also were doing that basic food program. We can do applications over the phone, and we continue to do that today, that we can do applications for the basic food program over the phone. The other way that we changed after adding these programs in, especially the colon program that was also for men, and the basic food program that men could access as well, made us realize that Positive Women's Network no longer defined us. And so we changed our name at that point to Citrine Health. And Citrine is a healing stone, and so we wanted to be recognized as a healing agency within the community.
Yeah, and I love that you mentioned the basic food program. That's also known as the EBT or food stamps. If anybody is needing that program, please let us know as well.
The TLC program also grew. The TLC program that we offered for women living with life-challenging illnesses, that grew after we started asking what more could we offer. And out of a focus group on what more we could offer became the idea for the Women's Wellness Center. And our Women's Wellness Center opened in 2007. And that became a program that was a monthly membership, but scholarships are available so that every woman could join, and they could join and be part of circuit training, and massage and Reiki continued, as well as we even had reflexology, and we had I did something called Bowen therapy, which is a neuromuscular therapy, also was offered. We also at times had hypnotherapy and belly dancing classes at the Women's Wellness Center. There was a women's facility where women could come to improve their wellness wherever they were in their wellness experience. If they were experienced in exercise and yoga, had done it all the time, or if they had never tried it before, they could come and be part of those programs at Citrine Health and be comfortable being there.
Yeah, the Wellness Center also had workshops to come on Saturdays for, women that didn't have time during the week. And that was really wonderful to be able to experience as well for any schedule that any woman had to be able to come to a safe place.
The TLC program grew out of a question we asked ourselves: is what more could we offer? How could we expand this program? And out of that grew the idea for a women's wellness center. And we opened our first women's wellness center in 2007. And through that program, which had a monthly membership, but scholarships were available so that everyone could join. And through that, women could access not only massage and Reiki, but circuit training and yoga and reflexology and something called Bowen therapy, which is a neuromuscular therapy for women. We also at times offered hypnotherapy and belly dancing. So it was a women's facility where women could come to improve their wellness no matter where they were, whether they were beginners and just starting out and never done this before, or experienced in exercise and yoga. It was a safe place for women to come.
What other programs has Citrine Health provided to better help the community?
And we have had trainings for health professionals, has been a part of it. We had training such as motivational interviewing and duty to report. And we also at one point were offering a human services council, bringing together agencies throughout the area to come together and share information and ideas. I taught HIV classes through that program for 16 years. HIV was one of the requirements for licensing or registration for health professionals in the state of Washington. So we had many people come through those classes on a regular basis. We also at one point had suicide assessment trainings, which was also a requirement through the state. We also have had Girls to Grandmothers, which were health fairs. And we called it Girls to Grandmothers and Grandpas too by the time we were done, because we wanted men to also access it. We had many big presentations for that, a big event starting in 2004 and up to 2010, we were offering those. And then, of course, we opened the bra shop, which necessitated our move into the location we're in now, where the bra shop being for women who have to access mastectomy products such as bras and prosthetics. And we have a professional fitter who can do that. And that continues today, that women can still access the bra shop and all those prosthetics and bras. Currently, like I said, the colon program did end, but BCHP still goes on. And even during the pandemic, BCHP has continued to go and to thrive, and women have been able to and continue to be able to access the services through the breast cervical health program. The bra shop continues through with the fittings for bras and prosthetics for women, and them accessing those as well. The Human Services Council is no longer holding meetings because of the pandemic, but down the road that may be something we'd also take on again. And the Women's Wellness Center is continuing now continue to have classes. We are starting to have classes again for yoga several days a week, so that is growing back as well. The basic food program has also been now incorporated into the outreach to historically underserved communities, which is a new program that Citrine has added just recently. So it also gives us an opportunity to not only to give basic food information to people, but also to help them with resources for all kinds of agencies and resources within the communities. It gives us the capacity to give people more information about other resources within the community.
Yes, I have been part of the OHUC, which is the outreach team, to be able to help out with resources. Citrine Health has so much to offer the community. And if someone wanted to know a little bit more, how does someone get more information about Citrine Health?
The easiest way to go is to call our office. There we have an 800 number, the 888-651-8931 phone number they can call, and they can get somebody through that. We also have our Citrine Health website and the Women's Wellness Center website. So they can also get access information about us through those. But the easiest way is to call the office. There is somebody in the office 5 days a week.
Yes, and we will put the link for the websites in the comments for everybody to be able to find it. If you could ask people to remember one thing about Citrine Health, what would you say, Anne?
What I'd say is our board of directors actually and some of us staff came up with the values that Citrine Health is founded on and continues to work on. And I think that's what speaks the most about the organization and who we really are and what I want people to take away. They've listed our values as integrity, research-based, inclusive, responsive, resourceful, friendliness, and innovative. And that to me says who the organization is and how we've continued to grow and how we will continue to grow in the future. So there's always something new coming around the bend, and Citrine Health likes to fill that gap of resources that are needed. And we will continue to do that using our values. So keep watching and see what happens and see how we grow.
Yes, we do like to change as a community's needs do change. Thank you so much, Anne, for taking the time and sharing the history of Citrine Health with us.
You're welcome. I'm glad to be here.
Thank you, Anne, again for sharing all this information with us. And thank you all for spending the time with us and learning about Citrine Health. If you have any questions on how we can help you or your program, contact us via our social media platforms, Facebook, Instagram, and YouTube, or our website, citrinehealth.org. See you next time at Citrine Health Presents. Bye!